seeing healthcare professionals so often. And I had some very interesting encounters in health centers in the Arctic, where a patient came in and, well, this was wrong, that was wrong, that was hurting, and a whole collection of symptoms. Didn't make any sense medically to have these all together. And I sat there and listened. And I have 20 minutes for each patient, which is a privilege. And the patient started to tell stories and just sharing. And in the end, after 20 minutes, I haven't done an assessment, a physical assessment yet. I haven't done any treatment plan nor any treatment. But the patient walked out of the office symptom-free and didn't come back for 2 or 3 weeks.
It just needed to be listened.
Needed to be listened to, need to have somebody here. So there's a spiritual deficit there that has quite obvious physical symptoms. And of course, I could have did a quick assessment, prescribe some remedy, and sent the patient to the dispensary and pick up some pills and on the way. And I could have guaranteed you that this patient would be back within a week with similar or the same symptoms for more treatment. So I would have done everything medically correct to prescribe pain medication, to prescribe various treatments for that person. And it would have been part of our healthcare system and part of the high cost of our healthcare system. But it was the wrong thing, because I'm only looking at the symptoms, but by spending my 20 minutes that are allocated to a patient to just listening to the patient, I was actually a lot more effective in promoting health than, no, I didn't cure any disease, but I got full symptom relief and I increased the quality of care of the patient for weeks to come.
So you're saying that the medical professionals, healthcare workers should have more time, and if we were into medicine as business, you wouldn't have been able to allocate those 20 minutes just to listen. Do you see any difference between for-profit health workers and salaried employees of the government?
Well, what I just described is one of the differences, because nurses are salaried. Advanced practice nurses, they do the job of a general practitioner, but they don't bill on a fee-for-service basis. And yes, they do have more time allocated, which is not for the good of the patient, because it's recognized they don't have a full medical training, so they need more time, because they're at the age of, well, compared to a doctor who's got full medical training, an advanced practice nurse doesn't have the same level of medical training. So the allocation of the 20 minutes versus the 5 to 10 minutes a doctor has is because of the training. But it is very beneficial for the patient to have that extra time, because also you come from a nursing emphasis, which is looking at the human health response, not at the primary emphasis in nursing is on the human being, not on the medical problem. So their nurses can bring a different emphasis. But again, I have a hard time thinking how we could transform the current system with a few easy shifts in budget lines.
A shift in budget, you mean, or shift in the procedures?
I think it really needs to be reconceptualized.
The system, the
that the
medical
whole
system?
the whole healthcare system needs to be reconceptualized in order to really be able to transform. Because if we just give the doctors 5 more minutes to talk to a patient, yes, it is a start, but the doctor will always be good at diagnosing disease and prescribing an appropriate treatment, but it won't change that we can like the healthcare system needs to start.
Shifting the system from what to what, I'm trying to understand. What is that it should shift? You mentioned before the instead of just treating, to have more prevention.
Yes,
That would be one shift.
that is one shift. Yes.
Is there another shift that you're thinking of?
Well, that we have to detach the thought of a healthcare system from the medical profession. The medical profession is one aspect of healthcare.
Oh, okay.
And they come at the very last resort. So the healthcare is there's a key definition. It's a complex interaction of the land, the social conditions, the environment, the politics, and the human being.
Exercise,
So
and diet, and
yes, these are so
components of
these are all. This is when we start to understand health from a
holistic view.
more holistic view, then we could build a new system. So if we emphasize that poverty reduction, more like social justice, is absolutely necessary to create health or to enable people to live healthy lives, then we don't need to hire doctors to do that part.
Not as much.
Yeah.
So
We still need the doctors to
Yeah.
treat when
But they're not the
disease
focus.
occurs.
Yeah.
But we need to understand why are people.
Why do they become sick?
Yes. I mean, cancer is a big business. There's a run for this cancer, that cancer every weekend, and you can donate for research of this and that. Well, we're just finding new and other ways of cancer affects people and how we can treat it. But again, we have, polluted this planet for decades and centuries now. We cannot bring this into a sensible discussion because it's outside of the medical realm, so it's not part of the discussion. But, unless we really consider all these factors, as you said, the social determinants of health, the other determinants of health, and create the whole system to gear towards that, then we can have still a treatment system at the very end to take care of those who still become sick.
Now, who would make those changes? You're thinking of a systems change,
Yes.
Not just economics. It's not just throwing more money to the medical system, but changing the proportions and of that budget. Maybe creating new departments that are going to look at determinants of health, whether it's exercise in community centers and recreation and arts and good economic base for the population. Who's gonna make that change?
Well, it has to be the people who want to have this change. And people are represented by government.
Okay, so the governments, if the people demand that from the government should make those changes.
Well, it would be, as I said, there is an example, and in Cuba where the government has taken up this cause. And I mean, if you look at, for instance, the health indicators of Cuba compared to the United States or Canada, well, their life expectancy is at least equivalent to the one in Canada. It's higher than the US. there's many health indicators there that show they have a very effective healthcare system. But if you look at the actual expense of what that system uses compared to the US,
Yes.
there's a
Big difference.
it's a big difference. And
Yeah.
so there is examples, and I think there's certain governments in, I think, Africa have tried to build healthcare systems. So I think the push needs to be from the bottom up. If we let the industry do, then it is a commodity, and the change will, well, you can commodify medical care, you can commodify the insurance industry. That's where economics come in, but you cannot commodify health as such, as a holistic concept.
I see what I mean, yeah.
You have to believe in health, and you have to believe that health is not a medical problem.
But
And so you have to reconceptualize, you know.
People have to be educated in a way that they can be healthier. And money, you're saying, is not a big issue. It's more the culture of people knowing what to do.
Yes, these are some cultural and societal assumptions that we live with that are not conducive to having the system changed. And one of those things is the whole concept of healthism, which actually came out of the same background work that led to the Lalonde report, where there is a certain responsibility of the individual for his or her own health, which eventually led to a very radical shift of what could be perceived as health promotion, but it's a very commodified health promotion. So people now, well, people with privilege have access to a lot of health information. They can make choices. So they can, well, buy things to stay healthy. And there's a whole industry catering to them. And it's the vitamins and the supplements and the alternative treatments and the exercise classes, and goes right down to the spandex gear that you need to stay healthy, and your water bottle, because, you know, these are cultural things. We don't need spandex and water bottle to stay healthy. No, we need to move our bodies, because our bodies are designed to move. They're not designed to sit around and just eat. But on the other hand, our life gets simplified. Well, it's not really simplified, but everything is here now for convenience. We don't have to split wood to stay warm. No, we just set the thermostat on the wall. So we don't have to, but then in the meantime, there's all these shifts over decades that make our lives easier, and now people with privilege can do something with that time, and they buy into this industry that promotes health, but
their businesses.
It's all about buying a yoga class and this and the right gear to it and your vitamins, and also if you're not healthy, assign blame, because if you all of a sudden increase your weight, well, there's something wrong with you, because you have done, we're getting into
too much,
sort of a religious
so the commercialization of health becomes an industry of advertising to make you guilty if you don't buy their product.
Yes, part of it. Yeah.